Stephen is a 14-year-old boy living in a small town in the far north. He comes from a large extended whānau where heavy drinking and cannabis use are the norm. Stephen goes to the local high school. Most days, he and his mates have a few puffs on the way to school. On the weekends, Stephen drinks until he's drunk with his family and friends. When Stephen is 16, he and his girlfriend go to the adolescent health clinic near their school. Stephen's girlfriend thinks she might have a sexually transmitted infection, and he's worried about himself too. During the appointment, the nurse asks them how they think they got an STI and if alcohol was a factor. After a brief conversation, they agree for a referral to be made for Stephen to the Alcohol and Drug Helpline youth line, who will text Stephen in the next couple of days. On the way home from school the next day, Stephen gets a text from the Alcohol and Drug Helpline counsellor. They text back and forth for a while, chatting about the referral, and Stephen says he will go online and tweet them that evening, which he does. Over the next few weeks, Stephen has a number of text, tweet and phone conversations with the Alcohol and Drug Helpline counsellor and makes a decision to cut down on his drinking because he doesn't want to get another STI when he is too drunk to use a condom. During these conversations, Stephen has a chance to think about what he wants to do with his life after school, his values and his goals. Stephen tells his mates about the helpline, and they all get together one evening before a drinking session and text the helpline counsellor for some advice about how to stay safer that night. By the time Stephen has finished school, he no longer uses cannabis and he has cut down on the amount of alcohol he drinks. His grades improved and he's decided to apply for a career in the Navy. The costs are travel, $480, training, $80, admin and preparation, $80, total costs, $640. Ongoing cost per intervention, 15 minutes clinic time with the public health nurse, $7.50 per session. In partnership with the Alcohol Drug Helpline, the Northland District Health Board has an opportunity to provide further support for individuals and communities and in return reduce the clinical costs and social impacts alcohol and drugs have on Northland. Early intervention works. Referring patients to the Alcohol Drug Helpline and ED saves money and lives. Call 0800 787 797.